like if you were packing cord for restoration, a composite or amalgam, that would just be on the gum line. So it will be laid, it would be a short piece that just lays right on the facial or right on the lingual. I've obviously have one cut for the entire tooth, but it would be the same way. So no matter what you're doing, for full or for just the facial or the lingual, you're going to want to start, and I usually tend to like to start on the mesial side because it's obviously the closest to the midline for me to be able to see. And then you want to step back from the very end, and then you want to get your instrument. And let me just show you guys what I was telling them. Sometimes when you're starting on your patients, when you're going into the room, you might want to try with your instrument to see what side, because all I'm doing is I want to use my instrument to slide down the side of the tooth. So you see how I have it kind of tilted in? Mm-hmm. So I'm actually rubbing down the side of the tooth into that pocket area. So that's what, sometimes then you'll know that you'll need to change your instrument because it's not going to work. So you'll see how this paddle positions. It might make it all the way to the front, and then I'll have to turn it. So if I can't, see how it would be really hard on my wrist to turn it this way? If I just flip the instrument over, now the paddle is in the right direction. Does everybody see that? Mm-hmm. Okay. And then if I get over here, then I may have to do the same thing. I'm going to have to flip the instrument again to finish placing. And I might get to this point, and if I see the instrument's going part on the tissue, then that's when I know it's incorrect. And then I'd want to change it again. You see the difference there? Now I can pack that. So you have to get used to that part, knowing when I have to flip my instrument. But if something doesn't seem like it's going in right or doesn't feel right, most of the time if you just flip your instrument around, so I had to flip at least 4 times to get from if you divided this tooth into quadrants or 4 sections, then it would be a change in pretty much every section of the tooth. All right, now back to the string. So sometimes it's just nice to get a feel with the instrument before, and I'm not saying go deep, just enough to know that where the pocket is. Okay, so when we place cord, we have it partially on the cord, and we're doing the same thing. We're just gently rubbing up against the side of the tooth to pack the cord. Remember, this guy's not real, so he's a little, I have to put a little more pressure than a real person.
And this what we're going to do on each other?
Yeah, that's what you're going to do on each other. And you're going to have to do it on your dentiform for your big check-off. So once I get it placed there, then I just back step it. And then what I'm doing is I'm really just taking every half step. So I go half where I've already packed, and then half where it hasn't been packed, and I lift it up, and I go one half step back, another half step back, and just keep kind of walking it slowly and just watching my instrument. And does my instrument need to be changed? Yep, because I can't get in that space anymore. So I'm going to lay the cord down and do the same thing.
That doesn't hurt.
It looks like it hurts.
I know, having something go down under your...
Well, I've done plenty of patients that haven't been numb, and they've been fine. And that was a bigger cord, so.
So how are we going to wrap this around our...
You don't wrap it around, you just have a facial and lingual piece, because you don't have a crown prep.
What tooth are we going to do it on each other? We're going to do an anterior tooth?
Posterior.
It's easier on posterior, seems like.
You only put the cord on posterior teeth?
You can put it on all of them.
You have wherever you have a class 5, whatever you choose. Okay, so some doctors may want, when you overlap here, because I know my other cord was, the beginning of that cord was already there, they may want you to leave out a small piece so they know where the end of it is. Most of the time they know, like how you pack, or I just tell them the end is on the mesial if I've never worked with them before, because I always pack the same way. But most of them want it completely tucked in. So when they come back to take that final impression, most of them want an explorer to be able to lift up that very end of the tail. And then they'll need the cotton pliers to be able to lift that and remove it. And this is the point where you would rinse and dry and then get ready to take your final impression. Okay, so as soon as that cord comes out, rinse and dry, and you would have to verbalize that because you won't have your dental dam on anymore. Rinse and dry, and then hand them the injectable light body material. Okay, so that would be that. Now the next thing that you have for checkoff is cement removal, which will be on the maxillary, usually in the premolar area, second premolar, so that you can use indirect vision. So same, once that sets up, you use your Explorer test. You want to look for a tacky feel, like it's not hard yet. It's getting ready to be hard. Makes it a little easier to get out. The other thing you want to do is you want to tie a small knot in your floss. So you just do just that, put a knot in your floss. You don't want to try to put the knot through the contact area. You want to start the floss toward the end and floss it in, and you want to do like a C shape around the tooth with the knot going back and forth, and it'll get those larger pieces out that are interproximal. Okay, and you also want to do the tooth adjacent to it. By the way, it's middle finger, and then use your index finger and your thumb to guide the floss. Does everybody see that? Okay. Obviously, you wouldn't be trying to hold your patient's mouth open at the same time rolling around. And then the same thing for the distal side of that. Anywhere that cement was, or it might have gotten in between the teeth, you do that first. And then you can come in with your Explorer, and where you've loosened those larger pieces up, you see how the Explorer will kind of wrap the tooth. So I'm going down, and then this side I'd switch the Explorer around. Remember we said there's a mesial and distal side to the Explorer. Okay, now you see where that works. And so for indirect vision, I was reminding the girls it's like getting ready in the morning. Don't think about it too much. Just use it for a direction. But you're doing the same thing. If I have a lot of cement, either on the tissue, you see how I'm using the curved part of it. I'm not trying to get off at this teeny tiny end because we'd be there all day. So if you just kind of do this, okay, and then if you need to change it so you have more on one side or the other, you see how you're doing that? And the same thing, if you got it a little bit on the tissue and you can't seem to get it off with a cotton roll, you can use that part as well. Okay? A lot of times when your patient is coming back to have a crown cemented, they're not numb, are they? No. So sometimes we need to use the very tip end just to kind of clean right here along the edge of the gum line. Does everybody see that? And then change the direction again. You're coming in this direction. The biggest thing is wherever I am in my mouth, I have a fulcrum. Your ring finger is your fulcrum point, so that you always have rest. Because I was trying to tell others, you'd be trying to this would be like writing without resting your hand down on the desk. You try that. How's that going to go for you? Just try to write something with that. No arm, no nothing. Just hand writing. Write your name. How's that feel? Yes, and see how that is? So if we're in the mouth with a sharp instrument and we're trying to do that, that's very scary. Okay, so that you'll hear us talk, we'll constantly remind to fulcrum. So it's either here that you might fulcrum, or it may be on the actual tooth itself, adjacent to the one that you're working on, wherever you have stability. So that's why I'm trying to teach my mom how to write with her pen or pencil like this now, because it gives you that, and you can still use your pinky, but you have a lot more surface area, a lot more pressure applied when you're doing it with your ring finger. Okay, so that's called a fulcrum when you're actually doing this and you're using small movements like that. Okay, fulcrum. Write that in big words.
So our pinky should be lifted?
Yeah, I usually lift my pinky, or if I need extra stability, I can use both. Most of the time what you're doing, see how I'm kind of balancing? Kind of like a balancing act if I was cleaning up cement around here, or if I'm doing gingival retraction cord, same thing. Okay, so that I don't have to move my hand too much, I'm just moving my instrument. Does everybody see all I did was that? So I'm keeping my hand pretty steady and then just changing the direction of my instrument.